Thank you very much.
Yes.
No, we have a person who doesn't talk very often, Mr. Avenanti.
I just have one question on the numbers.
Yes.
I understand what you just said. You're saying that basically what we
Use your microphone, you're not that good.
I think, well, not really.
Push the button.
Push the button.
Push the red button.
And I'm not doing it.
He's used his mic so much that it's broken.
That's what it is.
Let's try this. Okay. Just do better. 1, 2, 3.
You gotta
Just
down.
turn it
Push the button in the middle. Come on.
You don't do it.
Red. 1, 2, 3.
Come up here then.
It's got to be green, I think. Or red, I don't know.
Why don't you send him to his office to go and do it?
Here you go, this one works.
At least it did until I sit in front of it. Thank you. Okay, let's try this. You're saying that the only real monies that we're dealing with are $2.6 billion over
Well, not
5
really.
years.
That's not even real money at this point. That money will be bonded, so they have to sell bonds to raise that money.
But for
So it's not really
6,000
there.
units, is my math wrong here? That's like $80 a unit? Or
No, it's much more than that. I think you have zeros off.
I may have the
But-
zeros off,
yeah.
but it's not.
No, it's enough money to create 6,000 units.
At how much?
I don't have the number off the top of my head. I can get it for you. But it is enough money. It's just that it doesn't exist right now. They're going to sell the bonds to raise that money, and then we have to find the sites and get the developers and
Somebody do the math for me, because 6,000 times,
It's 1.7 billion, isn't it?
2.6 billion for 6,000 units.
that doesn't give you very much money. Somebody with a math skills, figure this out.
400.
How much? 400?
All right, keep going.
That's the only point I want to make, that 6,000 into 2.4 billion is a very small amount of money. If you take, downstate, it costs $300,000 to do one home, let's say. 10 of them.
One unit.
One unit. One unit would be 300,000.
Right.
Okay.
So-
So 10 units would be 3 million, right?
No, in this kind of situation, they're like anywhere between, it could be 180, for a unit, 180,000 with everything included to 240. That's not.
Or even 300 or 350 on Long Island.
Yeah.
But also 2.4 billion can leverage other dollars.
Yeah, that's a
400 units.
400,000 per unit that gives.
Okay.
400,000, right. So anywhere from 180,000 to 380,000, depending on where you are in the state. But that money can leverage other money. So I think somebody is going to get me the actual number, but
10.
the money will also be used to
3
leverage tax credits, potentially HUD dollars, potentially other dollars that are available in other state agencies. So it's not a straight calculation.
Okay.
360 a unit, 360,000 a unit.
360,000 a unit for 6,000 units?
Yeah.
Okay. My math is correct. It didn't
Yeah.
sound like very much, but okay.
But I
thank you.
think the point is that out of all of that money, out of the $10 billion, that the headlines are $10 billion for 20,000 supportive housing units. There's $2.4 billion that needs to be bonded before you can get the first 6,000 units. The next 14,000 units are a promise. In the out years, 5 to 15 years, there's no money there. The operating dollars are meant to be used in years 3 to 5. So really, there's about $74 million out of the $2.6 billion that's actually there. Yeah.
Thank you.
Thank you. Sean Francois, President of Local 372 Board of Education Employees. Oh, I met you.
Good afternoon, Chairman Farrell and Chairman Young, and all distinguished members of the New York City State and Finance and Assembly Ways and Means Committees. My name is Sean D. Francois I. I'm the President of Local 372, District Council 37. I represent over 23,000 school supportive staff members with the New York City public school system. I would like to thank you for the opportunity to provide the testimony on the governor's proposed budget for 2016-17 for mental hygiene. I'm here to provide testimony on behalf of our 300 substance abuse prevention and intervention specialists, what we call SAPS, with the New York City public school system, which is funded through the state's Office of Alcoholism and Substance Abuse Services. These members perform essential substance abuse prevention and intervention services for the 1.2 million children of New York City. SAPS counselors help our children cope with increased social pressures from their peers by providing essential mental and emotional support to ensure the child's healthy and adolescent development. In 2006, there were 502 SAPS counselors throughout the 5 boroughs. Today, we are down to only 300 SAPS serving 1.2 million New York City children. That was a loss of 203 SAPS counselors since 2006. SAPS counselors are present in approximately 1,200 New York City schools, totaling roughly 1 SAPS. I say that again, that's only 1 SAPS for every 5 schools. This is not enough to combat the rising use of drugs and increased social pressures for our youth who face through their peers and social media. While the growing prescription drugs epidemic, our youth are more vulnerable than ever before. The increase in drug and alcohol addiction, experiments, and dependency on our biggest challenge is to provide support for the increased amount of peer pressures and still address any underlying mental or emotional issues school children and their families face each day. We have students not only using more drugs and alcohol, but we are witnessing an alarming rise of prescription drug use amongst high school youth, especially in Manhattan and Staten Island. According to the Center for Disease Control, CDC, 45% of people who use heroin were also addicted to prescription and opioid painkillers. In addition, according to the 2013 New York City Department of Health and Mental Hygiene Youth Risk Behavior Survey, 8.0% of New York public high school students in grades 9 to 12 reported lifetime use of illicit drugs, cocaine, heroin, ecstasy, or methamphetamine. Youth residing in Staten Island are reporting the highest proportion of illicit drug use, 12.8%, followed by the youth who live in Manhattan, 11.0%. Local 272 SAPS counselors serving every 32 school districts and all students from K-12, or from K to 12, including special education. They specialize not only in substance abuse prevention, but also provide students with one-on-one counseling on anti-bullying, violence, prevention, confidence, building, goal setting, and gang prevention, and that's just to name a few. SAPS counselors are also trained to implement the most effective national evidence-based programs available. These programs include the Too Good for Drug curriculum, which is an evidence-based program being used in classroom settings, group sessions, and one-on-one youth interventions. This program is increasingly effective with youth exhibiting early signs of drug use. Having a science SAPS counselor providing a wide range of services, including individual and group counseling, early intervention services, peer leadership programs, positive youth development activities, crisis intervention, refers to substance abuse and mental health services. School-wide prevention projects and parent workshops will make a tremendous difference in the lives of thousands of youth at every school. SAPS counselors are critical in laying a child's foundation to create vital life skills needed to handle the increase in social pressures. SAPS counselors are specially trained and deployed to respond to serious events that affect school communities, such as death of a student or a gang fight, economically disadvantaged students who are the highest risk for alcohol and substance abuse, gang involvement, school suspension, disruptive behavior, and multiple violations of the discipline code are referred to SAPS counselors for intervention services. A specific example of this would be of the 139 high-level crisis situations from September 2014 to March 2015. Our SAPS counselors were deployed to assist in 76 of the incidents. In order for our youth to become productive members of society, we need your support of the SAPS program to continue its work. With the $2 million in funding from the legislature last year and $2 million from New York City, we were able to hire 54 new SAPS counselors. That is 5 additional SAPS per borough. And the rest were distributed between community schools. For us to be able to maintain the current number of employees and increase the program, we are asking for an additional $4 million in support from the legislature. The cost of a new hire SAPS 2 worker is $48,641, with fringe benefits totaling of $68,744. And with 2 years of service, the cost is $55,938, with fringe totaling $79,057. The investment in these jobs provide professional careers for New York City residents, creates economic stability for many New York City families, and hires employees within the community. Without the necessary funding, we will have to terminate those newly added employees and reduce dire need services. In 2009, the federal government ceased funding through the Safe and Drug-Free Schools Act for SAPS counselors in New York's 2014-2015 state budget. OASIS allocated $14,859,531 million to the New York State Department of Education to support the services that these counselors provide. We are committed to ensuring that this proposal result in the delivery of effective prevention and intervention services to the students and their families in these schools. SAPS counselors have consistently implemented evidence-based programs with fidelity. Our experienced and committed staff will be models for the new staff in providing the highest level of services to our students. In conclusion, Local 272 is asking the state legislature to allow us to maintain our current number of employees and provide additional funding of $4 million. While there are limited state resources, New York State has always been a leader in making opportunities for our children a priority. Our goal is to encourage more programs that are preventive rather than reactive. It is our responsibility to provide our children with the opportunities to thrive through safe and healthy learning environment. I look forward to working with all of you to make this possible. Again, I thank you for the opportunity. I come before you, and any questions you may have, present to the table. Thank you.
Thank you very much. Senator?
Senator Diane Savino.
I just have one question, President Francois, welcome. So if we increase $4 million, that will allow you to keep what you have and increase to how many more SAPS workers?
That would give, we have the current of $2 million that we had before from the last year's budget,
Right.
which gave us 54. So $2 more million, gives additional 54, which brings to 100 some SAPS workers. But Senator Savino, I would like to add though, if we can have that as a mandated, or try to get that to be a mandated structure, so every year we don't have to come back and keep trying to add on money for district establishment workers, if we can get that to be occurring, I think that would be something substantial that we need to have.
Is the city also matching the increase
Well,
from last year?
Yeah, they did last year, yes, sure.
Okay.
2 million to 2 million. They'll definitely give it to 4 million.
Are they proposing it in the city budget now
Yes,
also?
we will, absolutely.
Thank you.
Absolutely.
See, but if we gave it to you and you didn't have to come back, we would miss you.
For sure, I appreciate that, for sure. Absolutely.
Thank you.
Thank you so much.
Thank you.
We
Thank
good?
you.
Okay, thank you. Appreciate it, thank you. Thank you, see you later.
Kelly Hansen, Executive Director, New York State Conference of Local Mental Hygiene Directors.
Thank you.
Good afternoon.
Good evening. Thank you very much. Thank you very much for the opportunity to present testimony to you. My name is Kelly Hansen. I'm Executive Director of the New York State Conference of Local Mental Hygiene Directors. I represent the 58 county mental health commissioners in the state who are responsible under statute for community planning, oversight, funding, and delivery of services for adults and kids in the community with mental illness, substance abuse, and developmental disabilities. So while they're separated at the state level, they're connected, interchanged at the local level. Given the time, you have our testimony, and you've seen a number of things that we are interested in talking about. In the spirit of time, I want to talk about three things. Managed care readiness, the 730 jail-based competency restoration for felonies, and also to tell you a little bit about what some of the county jails are doing with some pretty exciting demonstration projects using Vivitrol for individuals with addiction who are reentering, being discharged back into the community. So, you've heard from others here that there's a cut to the managed care readiness for the adult system. We obviously would like that cut restored. And the reason why is because this is the biggest transformation the behavioral health system has gone through in years. It is a huge undertaking. The providers need help with technical assistance, with IT, which costs a fortune, training of staff, being able to become Medicaid billers. We're not done with this process yet. We have a lot more to go on the adult side to get this as a finely tuned working machine, and we need all the resources we can get. On the children's side, also a significant overhaul of the children's system. And you heard Commissioner Sullivan talk about the policy behind it. The policy behind the revamp of the children's system is solid. It's good. It identifies children earlier. It recognizes trauma and the impact of trauma in childhood and a risk of addiction and mental illness later in life. And it uses evidence-based practices. Huge undertaking. In order to do this, we need more than $5 million in state share to do this. This process is comparable to like turning an aircraft carrier in a bathtub. I mean, it is really huge, but it's a great model that we're trying to pursue here, and it's going to be really good for kids and families. But if we don't have the staff that's trained, if the counties that have the single point of access for children and youth, this is where the families enter the system with a single point. If we don't have the assistance that we need to be able to do what we do in terms of shepherding those kids through the system and also to get them services while working with the DSS commissioner, a lot of these kids are in the custody of the commissioner because they're in foster care. The counties work closely with juvenile probation, family court, the schools. Our role as being embedded in the community is going to grow even more, and we need funding for that. And also the measurements that you heard Andrea Smith from the Coalition for Children's Behavioral Health, who's joining us in this request, had mentioned there's no good kids measures out there. We ask nationally, and it's just not there. But we need to be able to do something to measure the success that we're having, we hope to have with this new model for the kids. So the other piece that you heard a lot about today is the proposal to allow for jail-based competency restoration for individuals charged with a felony offense. So the quick refresher on this, someone who is charged with a felony and is determined to be incompetent to understand the charges against them and aid in their own defense needs to be restored to competency, and that activity takes place in either a state psychiatric center or an OPWDD facility, generally Sun Mountain, Tupper Lake, and Valley Ridge in Norwich. So, and I know the conversation has been a lot about cost, but that's not the issue for the counties. And I've canvassed my members. I don't know of any county mental health commissioner who's interested in pursuing this. And the reason why is because, number one, we don't feel like a jail is a therapeutic place to return someone to competency. The jails aren't physical plants structured that way to be able to do this. They don't have the staff to do this. Jails cannot and don't medicate over objection, which in some cases can be a very important part of recovery and stabilization. So we are opposing that. Well, I mean, it's voluntary, and that's good. But in the meantime, the executives booked $2 million in savings on this. So what we are asking for instead is for support for legislation that we have, which was recently reported out of the Senate Mental Health Committee, and it's currently under consideration in the Assembly Mental Health Committee, which is a bill that we refer to as the chargeback bill, meaning what we're saying is that the county, for individuals who are being restored, would pay their 50% for the first 30 days, and after that it becomes a state responsibility. And the way that this works now is the individual who's charged with a felony is under the custody of the sheriff. When they go to a state facility to be restored, they are then under the custody of either the commissioner of the Office of Mental Health or the commissioner of OPWDD. Yet the counties are still charged 50% per diem for the cost of this. It's also very unpredictable to be able to plan for. Counties could go 5-6 years without a single 730, and then all of a sudden they have 4 730s and they have $1 million charge to their budget. So we will be approaching you for your help and sponsorship and also support for our chargeback bill, which would limit our exposure to the first 30 days of competency restoration. Finally, I just want to take a second to talk about some of our county jails are doing some pretty neat things with trying to help people who are in jail on a drug charge and are interested in pursuing recovery once they are discharged and reentry. Part of the reason why this particular location works is because in order to use Vivitrol, which is the 30-day injectable that has had great success, is the person has to be sober for 7 to 10 days. If they have the injectable without that, they become very sick because it instantly puts the brain into withdrawal. So someone who has been incarcerated and is ready to come back into the community is a very good candidate for success for Vivitrol. So we have a number of counties who have developed programs and are using protocols that would allow the individual to begin Vivitrol while in the jail prior to reentry, and then all the services are wrapped around them, every service possible, when they first are discharged back into the community. That's the most fragile time for someone who is entering back into the community again. So we have a number of counties that are doing that. We're anxious to be able to come back and report data and good experiences. So thank you very much, and I'll be happy to take any questions you have.
Thank you. Assemblyman Oaks.
Yes. Do you have a list of which counties are doing that?
I can get that for you.
Thank you. Appreciate it.
Further questions?
Yes, Senator Boyle.
Thank you, Kelly.
Sure.
Just a quick question. From my time as chairman of the Senate Task Force on Heroin
Yours is not
Opioid
on.
Addiction. Oh, I'm sorry. Can you hear me?
Yeah.
From my time as chairman of the Heroin Task Force in the Senate, we looked at Vivitrol and was very impressed with it. But it was hugely expensive. I don't know if the prices come down. How are the county? To me, I think I remember like $1,000 a month or something like that. How are the counties handling that?
Yes. The county is working with the manufacturer who is donating the first shot in jail, because also remember there's no Medicaid dollars going into because of the inmate exception. The good news is that Vivitrol is included on both the pharmacy formulary under Medicaid managed care and the medical formulary to pay for the clinician to be able to administer the shot. So that's good. But the issue in the past, which hopefully we're working through, has been the buy and bill. You would have to buy the drug first, for a specific person, and then get paid later. And it's a very expensive drug. So we're very pleased that this will be on the managed care, that is on the managed care formulary.
Great. That's pretty much the same question. Thank you.
Okay.
Thank you.
Thank you.
All right, thank you.
Robert Lindsay, CEO, Friends of Recovery of New York, to close. This one.
Well, hello there.
Hello there.
Very grateful for the opportunity to be here and very grateful for your patience. This has been a long day for you in particular. My name is Bob Lindsay. I'm CEO of Friends of Recovery New York. Honored to be here today to talk about the public health crisis of addiction in New York State. Friends of Recovery New York represents the voice of individuals and families in recovery from addiction, families who've had a family member who've lost their battle with addiction, and others who are impacted by addiction. The stigma and shame that surrounds addiction has prevented millions of individuals and families from seeking help. Friends of Recovery New York is dedicated to breaking down those barriers created by stigma that result in discrimination and policies that block or interfere with recovery in terms of access to addiction treatment, health care, housing, education, and employment. And because of stigma, the more than 23 million Americans today that are living life in recovery have been unwilling to come forward and speak out. No more. Our voice of lived experience in recovery must be heard and must serve as a guide to all efforts that address this issue. Yesterday we had our Advocacy Day. We had 300 advocates here, the majority of whom were in recovery, family members in recovery, families of loss. Extremely powerful and committed bunch of folks. Regrettably, though, on a daily basis, the heartbreaking tragedy of active addiction is played out in countless media stories, in community forums, in homes, and in families across New York State. For New York wants to thank the governor and the members of the Senate and Assembly for listening to the people of New York in an effort to respond to this crisis, but now is the time to act. The call to action in terms of budget recommendations, as we all know, the state budget is more than a statutory requirement. It is in fact a statement of priorities for policy activities of state government. Clearly, addressing the addiction crisis in our communities is not a priority in New York. Senator Martin asked earlier, should we declare a state emergency? The answer is absolutely yes. Take a look at how this is devastating our communities. And as taxpayers, the state funding that we have invested in OASIS and local community-based prevention, treatment, and recovery support services is grossly inadequate to meet the needs. We are extremely grateful to OASIS for all they've done with so little financial support. The Combat Heroin PSAs, the Kitchen Table Toolkit, leadership in trying to break down some of the issues around insurance, on and on. Their commitment about youth clubhouses, recovery community centers, all desperately needed. But literally, they are fighting a forest fire with a garden hose. If you look in terms of context, the increase in the developmental disability budget this year is $170 million. You've heard from many people it's grossly inadequate. But that $170 million represents 28% of the entire addiction budget. I mean, and it's just to put it in perspective, the reality is we've not made the financial commitment to be successful in battling the addiction crisis in our communities. It is time that we stop investing in the problem and start, which is active addiction, and start investing in the solution, which is all about recovery. So our ask is very simple, and we're very invested in supporting prevention, treatment, and recovery services. Our ask, though, is specifically about recovery. It is the single greatest unmet need in the addiction field, and that is that we engage people in prevention, we engage people in treatment, but when they leave treatment, the supports that they need, the supports their families need, are not in place. So we're asking for a $50 million investment in the infrastructure to support addiction recovery services for individuals and families. Number one, $10 million for recovery community organizations in every community. This is all volunteer life and energy. There are millions of people across New York State passionately invested in this issue that will do anything that they possibly can to create change in their communities. But we need to be able to organize them in a way that they can do that work productively and positively. Secondly, we need a recovery community center in every county, $20 million. Oasis received 90 proposals for youth clubhouses and recovery community centers. And you heard earlier, they can only fund 6 recovery community centers. They can only fund 7 youth clubhouses. And then the third piece, is peer recovery coaches in every county. The next piece is family support navigators. Families are absolutely lost when it comes to dealing with addiction services. They are treated as the keeper of the paycheck, the keeper of the insurance card, the person providing the transportation. They desperately need information, education, and support so they are able to face this crisis effectively, not only for the family member they're concerned about, but for themselves as well. And our failure to meet their needs and their support is killing families, killing individuals. So our commitment here is we're asking for $50 million, but I absolutely guarantee that there is a partnership that exists out there in communities all across the state, in your districts and every district across the state, where families will do anything that they possibly can. Volunteer, donate their time, generate the kinds of resources that are needed and necessary to get this job done in the community. And that's the only place where we will effectively address the addiction crisis here in New York. That $50 million can very easily and very quickly become $200 million in terms of volunteer commitment, donations, support. We have recovery community centers where they want to get started. Communities said, we'll donate the space. We'll donate the renovation. We'll donate the work, the labor. That partnership exists, but only if we make that initial investment that gives us the capacity to coordinate and manage those resources and services. So very simply, I also included some other issues around regulation and legislation that are important to us as individuals and families in recovery. I'm glad to talk to you about those. But plain and simple, without the dollar investment, we will never effectively address addiction crisis here in New York State. We desperately need your help and support. We will do everything that we can to partner with you to make sure that works across New York State and every community. So thank you for your time, and I'm glad to answer any questions.
Thank you very much. Questions?
Thank you.
Thank you.
Wonderful. Thank you for your time.
We are now adjourning for about 2.5 minutes.
You're welcome. Thank you for your patience.
Well, about 10 minutes, we'll call everybody down.
I need more than that to get to the ladies' room.
Oh, wait. 20 minutes.